Dear Yik Yak, my boyfriend can't get hard because of the fear of pregnancy, even when he's wearing a condom. Help. Thirsty and confused.
Whoa.
This is a really good question that I think is getting to this kind of theme that we've talked about before of like mental health and physical and sexual health.
Totally.
So like we can sometimes have things going on in our brain that might not be connected to like what's going on in our body.
And yet impact it.
Exactly.
Completely, yeah.
Exactly.
So there are a few different avenues that could be pursued here. The first is that this person's boyfriend should definitely check in with somebody about this clear anxiety that they have, because it's clearly impacting his life, his sexual life, and probably, I'm going to guess, other parts of his life too. The other side of it is we don't know if the person writing this is on any sort of contraception.
Right.
And I'm wondering if that would help this situation.
Right.
But the bottom line, you're absolutely right, is that there's a very strong connection between the mind and the body, and that is a really wonderful thing when we're talking about like sexual arousal and pleasure. But the other side of that is that if there's stuff going on up here, it can absolutely impact libido, drive, arousal, orgasm.
And this is a situation where I think really both partners need to be super involved in the type of birth control they pick, because clearly condoms, maybe they had a discussion about using that for pregnancy prevention, but it's not working with their sex life, so they need to pick probably another form of birth control that the person using it feels good about for what's going on in their body, and then the boyfriend feels good about so that they can have sex the way they want to have sex.
Absolutely. And in a lot of cases, some people feel really comfortable with more than one method.
Right.
So maybe the person writing this could start something hormonal, perhaps, maybe not. But there are other barrier methods besides condoms that they could discuss using, like diaphragms, that might be more conducive for the male partner. Because if there's an erection issue, then that might help alleviate some of that pressure. But communication around what's going on for this person, if they're talking to anyone else about it, and what can they do together to kind of alleviate that anxiety.
Yeah. Good luck.